Hello everyone, Kevin Carrillo here, and welcome to another episode of the Cannabinoid Connect podcast. My guest today is Josh Swider, co-founder and CEO of Infinite Chemical Analysis Labs. Josh Swider, how you doing, man?
Pretty good. How you doing today?
I'm good. Thanks so much for spending time with us today. I appreciate it.
Definitely. Glad to be here.
Awesome. So where are you located?
Right now, I'm in San Diego, California. We started a lab out here about 5.5 years ago, and we actually have another lab in Michigan as well, Jackson, Michigan. But this time of the season, I try to stay out here in San Diego, California.
San Diego, man. I had a guest on yesterday. His name was David Metzler from the CBD Capital Group, and he made me so jealous because he showed me his window view of the ocean, and he's like, "Yeah, my next meeting is going to be a walk on the beach," and I'm like, "Here in Texas, you know what I mean?" So, but hey, you know, we have our own things here, which are good. We don't have water, but we've got other things. We got barbecue. So
yeah, you got some nice lakes too.
That's true. Yeah. For those listening, we have Josh Swider on. He's the co-founder and CEO of Infinite Chemical Analysis Labs, and their mission is to provide the cannabis industry with accurate and timely analytical services of the highest quality while meeting or exceeding their clients' expectations. I know that's really kind of like a Google boilerplate description of the company, Josh, but you know, when I did research, really what I came to the conclusion of is you guys are fighting the good fight on the front lines as we're waiting for FDA guidelines in terms of messaging and marketing for CBD products. You're actually the ones testing to ensure, you know, all the residual contaminants like pesticides and solvents and other things are all at a reasonable level or even not apparent. So why don't we talk a little bit about that?
Yeah, we've definitely, so Infinite Chemical Analysis Labs, we've been in business for about 5.5 years. We started at a location in San Diego, California. There's two guys in a 1,200 square foot lab flipping instruments on the side because no one was testing their cannabis or hemp for dangerous materials. You tried to sell that service and they were like, no, I'm good with that. I don't want to prove it's bad. But we've definitely grown from then. We're just moving into our third location, which is 16,000 square feet in San Diego.
Wow.
We did a complete remodel of the building, built it out exactly how a laboratory should be set up. And then we now have about 60 employees out here in San Diego. And last year during COVID, even we pushed through to get our Michigan lab location out in Jackson, Michigan, where we now have approximately 30 employees out there in an 8,000 square foot facility. We're always here fighting the good fight, like you said, and definitely trying to keep even potency analysis on par with the labs and trying to provide at least a consistent basis and, you know, a correct value for people to look at and not necessarily, you can't buy our results, you can't buy the values. And that's kind of the dismay in this industry, what we've seen, but definitely growing and getting there. And I think the more we work on it, the better we'll get.
Right. Well, let's talk about, before we jump into Infinite Chemical Analysis Labs, and congratulations on the growth that y'all have been seeing. Let's talk a little bit about your background and how you got started in the cannabis industry.
Yeah. So when me and the other co-founder, Dave Morelius, we were finishing up grad school, and I was working on a PhD in analytical chemistry, developing ionization sources for mass spectrometers. Probably 1% of the population understands what I just said. Pretty much nerdy analytical chemistry stuff.
Yeah,
it's great.
I definitely don't know. And so if you want to dive deeper into that and help people catch up, that would be good. If not, we can keep going.
So, yeah, definitely. So pretty much I would work on instruments, developing the instruments to actually use to test the products in the cannabis industry and to advance them. And then the co-founder Dave, he finished his PhD in organic chemistry, and we were. This is something that always bothered me. Is it was 7 years ago, and the analytical chemistry community always was written poorly about in all these anytime it came with cannabis or hemp or anything like that with a testing lab. And that's something that bothered me as an analytical chemist and someone that held like these things to high esteem and having scientific integrity, that these labs are seen to just give away results. And I asked myself, why are these people out there not qualified doing this? So I primarily came into this industry to clean it up and to provide accurate results and to point out when people aren't. I mean, we're pretty out there with showing things and doing studies and open up our doors to anyone that wants to come test us, as in the BCC or any other regulatory body that wants to give us blind samples, because we're very confident in what we do. And we're here to make the changes. So my background is pretty much analytical chemistry with a passion to change an industry that was started poorly, in my opinion.
Right, right. Well, I mean, with no kind of oversight, right? No oversight and guidelines or regulations to help kind of keep us in our lanes here. So that's why I commend y'all so much for what you're doing. And when you talk about this kind of light bulb moment, and you saw the opportunity to do and provide better testing. This was during, and we're going to set the stage for the audience in terms of, this was the time when California was bursting into the medical marijuana industry. And at the time, as this was happening, the federal government did not hold cannabis businesses to the same standards as food and beverage, right? Or even supplements. So
there was no standards at all. They were just getting written.
They were just getting written. Exactly. Yeah. So as California's cannabis industry rapidly grew, we saw the lack of quality control created, and it created a minefield of just this spectrum of, you had professional testing labs versus people operating in kitchens and garages to produce products and whatnot. Right. So, I mean, talk a little bit about that journey and how it's either gotten better or worse, in your opinion.
Yeah, definitely. I mean, that journey has been a long one, to say the least. Like I said, we were just coming out of the grad school, and you don't have a lot of money. We started this company. It was me and Dave with $20,000 each, with everything I had, and was running on credit cards. And what we would do is buy instrumentation, fix it up, because I can repair all instruments. We'd fix it, and then while we're using it, sell it, and then make more money to buy a better one. So I mean, like everyone else in this industry, I didn't have the millions of dollars to start out day one, but I knew the capabilities of the instruments I was buying and fixing up. So that's what we did to bootstrap the whole company. 16-hour days is still normal, but we're here doing it. And then we built up the brand and the company to be able to test things. And the further we went into depth into the regulations and helping mold the BCC regulations and the Bureau of Cannabis Control, that is, for the state of California, or even the hemp, we've been vocal in that as well. We've pointed out problems with methods, or where things need to be tightened up, and we've grown with it. So when the requirement, let's say, was to start doing heavy metal analysis, we bootstrapped every dollar we had together and bought an ICP-MS brand new that was capable of doing the limits. And that's one thing we always pushed for, is knowing the equipment we needed to buy to get to where we need to be, and the personnel we needed to hire. So it's been a long road, but it's been a fun one and exciting. And we love to push the limits and see what we can get for better testing and better analysis. And we're always developing new methods, and we're always in contact with Bureau of Cannabis Control or anyone else that's willing to listen, to kind of to make this industry grow, to make sure that, because our primary focus is public safety. I mean, that's what we're here for. We're not here to give someone high THC results or clean product. We're here to make sure that someone's going in the store, they're going to be buying what they're buying, and to make sure it's safe. So that's our primary focus here at Infinite Chemical Analysis Labs.
Right. Well, and that's a good focus and a much needed focus, especially during this time where we're still at the forefront of the industry. And I want to touch on what you alluded on, and that is how you kind of had the right team, and you had the experience and the background when it came to these instruments to really know what you needed and what you had to buy to be successful. And while of course you can't do it alone, it sounds like your background was like instrumental in this vision for Infinite Chemical Analysis Labs.
Definitely. I think background, the big play on this. I mean, back 5 years ago, a lot of the infant companies were just starting to come up with methods, the internal methods to run like a potency analysis even. And they were selling methods and they weren't taking things into account because all those instrument manufacturers couldn't get real world samples into their labs. They could only run standard. So they would never see the problems and they started selling these instruments to everyone and they wouldn't look for the problems. So that was one thing we always felt like we've given a step ahead was we've always ran real world samples. We've developed our own methods. We've never taken a method and bought it from an instrument manufacturer. We've looked at the problems and kind of dissected any method we developed and validated it to be the most efficient, correct method we could do.
Mm-hmm.
That's one thing that's I think you strive at with these companies, and not one man can do it alone or one woman. We're out here, we're working in teams. I mean, at Infinite Chemical Analysis Labs, we have over 35 scientists that range from bachelors of science to PhDs, multiple PhDs over here, when we all work together as a team.
Mm-hmm. Well, and having that brain power on your side and being a step ahead, it's also clear from the research I saw, like this year, CBS reported that 80% of vapes tested in your lab were determined to be unfit for consumption, and over 60% failed for pesticides, while almost 40% failed for lead. So, I mean, is this the current climate we're living in terms of vape cartridges and really not knowing what's inside the oil?
So that's a great question. And what we've been doing throughout the years is kind of, I feel like if we start back when it was cannabis only, we would see very, very high fail rates. It's because the industry wasn't clean. I mean, people weren't taking into consideration. It's not always the cannabis grower that's causing contamination. So a lot of times when we're talking about vape cartridges, so we're going to start with a biomass or a plant cannabis. Go ahead. They start with that, and then they go ahead and do this concentration step where they're concentrating their CBD or whatever the cannabinoids by a factor of 10, let's say. Well, what else do we concentrate? Well, we concentrate all the contaminants like pesticides or lead or anything else that was in that plant during that process. So what happens is that they end up getting these distillates at the end that maybe the farmer didn't use it, but his neighbor was using that pesticide. And now it's enough to fail the cannabis regulations. So we see this in the R&D testing or quality assurance testing. So most things that are tested, they're always tested, they're tested numerous times. Well, if someone buys a product to make a distillate, they're going to test that. They're going to do a micro extraction and kind of concentrate the stuff up to make sure they don't have pesticides or contaminants. Then they're going to have to do distillation, concentrate the product, and they test that final product and say, hey, did we make a good product? They want to check their steps along the way because they're going to spend millions of dollars making this product. And they go ahead and now they're going to go ahead and put it in pens. And this was the thing we saw a few years back, like 3 years back when we started actually testing the pens, is there's a lot of cheap hardware. So like the vape carts and the vape pens, they were being produced in other countries, not name anything. And it was just a cheaper product, and they have allowances for lead and other heavy metals in them. So what happened was these people would put it, they would test their distillate, because more than likely distillate's never going to have a heavy metal in it because of the distillation process will remove heavy metals, mostly other than arsenic. Arsenic can make it through the distillation process. So then they'll go ahead and put it into a pen, and then this pen sits there. And we've done studies with clients that care, and like, okay, if I buy this pen and I pen it today, they would pass. And then a week later, it sits in that pen. We would test it again. Oh, it's almost failing. 2 weeks later, 2 weeks after the initial date, we would test it again. Oh, it's failing horribly for lead. So what's happening is the distillate will leach out the metals. So over time, it gets more contaminated. And those were like the cheaper carts that people really moved away from. We were in a big wave of that and helped out some great manufacturers out there look into that study.
So when you say that wave of those harmful pens were released, it's because the manufacturers were only testing at the end when they were putting it into the cartridge, not all along the way? Or
no, so they would test at the end when they produce that final package, right?
Right.
But then what happens when it sits on the shelf for 2 months?
Oh, I see.
And after that, so that's one of those things. Even to today, that's something that should be looked at. I mean, honestly.
So that's the first time I've heard that in terms of there should be a real concern about shelf life for pens, because ultimately, naturally, over time, they will be filled with more lead and other.
If the pen will leach lead out, yes, it will. And then, so the interesting part is it's not always straightforward. So you put a regular distillate in there, pure distillate that doesn't have terpenes in it, it's going to be less likely to leach out lead. You start adding these acidic and basic terpenes potentially, it'll leach out lead faster. We've even gone to as far as to name or go look into which terpenes will extract more metal out of these pens. And we worked with various companies doing that. So that's cannabis, and like we've known, like cannabis kind of grew because of this. And the good actors out there are paying attention to this stuff and fixing the problems. Now we come to hemp and CBD material.
And it's a whole different ball game.
We made it so far, and then we're going back to the beginning. And I'm not saying everyone, but it feels like cannabis day one again last year. And then there's no regulations, and we're not looking at heavy metals, or not. And there's no regulation to look at it. We have very good manufacturers that we work with that always look at heavy metals. It's just not required because they know what the right thing is to do. So now that we're creating this whole thing again, my personal opinion, you go buy some of these pens that are CBD vape pens, you're going to have those lead problems again because they're not looking at it. They're potentially just trying to get as cheap as possible on the shelf. So those are the things like I would express to any kind of consumer or anyone watching this program is, hey, check out, see what their COA say, or COA or certificate analysis. Are they testing for it? Or are they only testing for potency like I would say most of the CBD market is? Or are they testing for the heavy metals and looking at this? Are they looking at pesticides and other things in there? So when we do test for that kind of stuff, it can be very alarming. We've done studies and spent our own money just to show this stuff. And here's a case study that we did. We bought the products off Amazon for CBD and hemp material. 80% of it contained no CBD. So pretty much a manufacturer selling on Amazon was buying gummy bears from Hasbro or whatever large manufacturer, taking 10 of them, putting in a bag and selling you a 5 million% increase.
Hold on. I want the audience to understand that because that's heavy. Okay. You said that you source products from Amazon, CBD products, to test the efficacy of the CBD, and the results came back 80% did not even contain CBD.
That is correct. And then they contain pesticides in other places and solvents and things that were harmful that you should not be consuming. The ones that did, and or THC. I mean, so someone would thinking they were going to eat it, and then their work doesn't allow for THC because that's still state regulated and mandated, and they're eating this CBD product that says THC free on it. That's just a blatant lie.
Yeah,
and then they're putting their customers at jeopardy.
They get popped with a drug test and they fail for THC and they lose their job.
And they're eating these CBD gummy bears they bought off Amazon.
Wow. That is so crazy, man. And you know what? It's such a detriment, like all that snake oil that we've heard that's out there just because of the saturation of the CBD market currently, is that it's such a detriment to the overall industry, right? Because you've got someone, and maybe someone older, and they're interested in alternative, therapeutic properties like CBD and whatnot. And so they try it and they're not even getting the full effect. And then they give up on it after one or two.
They get no effect, right? They're trying a fake placebo, and then they get a negative stereotype of this whole industry. And that's one of the things I totally agree with you, and I hate the most is you see people like, I'm going to give it a shot. Oh, Amazon's convenient. Oh, I just bought a fake product. I feel nothing. CBD's bogus. And they get this in their head, and then it never moved past that. It was they never really tracked it or don't have appropriate testing regulations. We've worked with Amazon even in the past to try to get them to push more testing. We were instrumental with them making these products have to have a COA with them. So a long time ago, Amazon was just getting the product and shipping it. And then we pushed as hard as we could to get Amazon to require a COA at least. Doesn't mean it was real, but at least it was there. You know what I mean? We tried.
Baby steps, man. I mean, hey, Amazon's a huge conglomerate. The fact that you can move the needle even in that smallest way is a huge win. So you're on the right track with that,
Definitely.
But
yeah, that's what we're here for.
Yeah. So I do want to talk about, so let's talk about the vaping crisis of last year. Right. And I really didn't follow it so much. I heard a lot of the scare kind of within the media, scare tactics and whatnot. But one thing that I was researching before we talked, and I saw an article, and the CDC had claimed that vitamin E acetate was the basically the cause for the lung lung cancer, right? Something
Shutting down the lungs pretty much, yeah.
right. Yeah. So it's connected to the lung situation that's happening with the vape crisis. And so, but I read an article saying that the cannabis plant naturally produces vitamin E, and the majority of plants do the same. Um, so are we talking about synthetic vitamin E acetate that people are putting into these vape cartridges, or are they, as the CDC, actually saying that vitamin E itself is the cause of these lung problems?
So we always got to remember there's a difference between vitamin E and vitamin E acetate. All the plants do contain vitamin E and very, very small amounts of vitamin E acetate. You will see it potentially in a distillate because you are concentrating it a lot. So let's take a step back even on this and think of what we've seen and share our experience. We saw this before the CDC saw this, long before. We were starting to get distillates coming through, or someone would bring a pen in. So we don't test for the illicit market. That's not what we're here to do. But we will test for anyone that walks through that door and say, "Hey, I have this vape pen." That even we had people. My daughter, I found this in her room. Will you test it? we want to help them. They're like, "I'm concerned."
Yeah.
This picked up a lot more after that vitamin E acetate. But we started seeing stuff where like a buyer will try to buy something from someone else, and we were starting to see like 20-30% THC in a distillate looking form. The reason why THC acetate is so good of a cutting agent to hide delta 9 or the concentrate, its viscosity is exactly the same as the concentrates are. So when you take vitamin E acetate and mix it together, you're going to dilute everything. So we kept seeing these things. This is a couple years back. We kept seeing these very low ones, and someone would buy 10 liters and it would be 40% only, and then it's a large volume. So then we started looking at it. And we looked into, because we can do exploratory work. That's what, honestly, that's what all of us, we're nerds and scientists at heart. We'd rather do that stuff than the daily. So we look at these things, and we saw it with vitamin E acetate. We've seen cuts, and that was the best cut, to make it look the same. Horrible for people. So then the assumption was people out there were like, "Oh, I can just cut this. So I can start with 1 and create 2 and make double the money." It's just vitamin E acetate. You can eat that, so it's fine. And then there's no one there saying, "Hey, hold on, someone should probably do when you're smoking this and combusting it and like inhaling it. What's going to happen?" So like, no one did that. And a few companies got out there and started selling vitamin E acetate. And they called themselves various names. I'm not going to put out there because there's a lot of legality stuff going on with that right now. They would sell it for like, let's say $200 a liter. They were buying it for 20 cents a liter. So then they started selling to other people so they can cut the material and then rip someone else off more. It's an illicit market thing. And that's why we didn't see this come into the legal market either. It was mainly in the illicit market. But more or less, to make it back to kind of your point in the beginning, will it have vitamin E acetate? Yeah, we'll talk about vitamin E acetate at the part per million, part per billion level. Yes, it'll have that. But what it's so very, very, very dilute. But then when we talk about the bad product that was getting people sick, well, now you're talking about 50%. Half of it was just vitamin E acetate. It was very concentrated. One's like a drop in a swimming pool concentration. The other concentration is half the liquid. So that's the problem. So you can inhale it and your lungs can get rid of vitamin E acetate at low concentrations. But if you're like guzzling this stuff pretty much to your lungs, it does not do well. You're drowning yourself. Kind of a way to think about it, I would say.
No, that's a really good way to put it. And I'm with you. I'm on the same page. And so my next question is, would one indicator of a vape cartridge found in the illicit market, like turning to black instead of that golden honey, would that be a factor of it being so filled and concentrated with that vitamin E acetate, or are those other factors?
That's actually something different that you already brought up today. A lot of that stuff is heavy metals being leached out of the carts. The black color and the dark color. I mean, if we're talking about black leaching, a lot of that was heavy metals is coming out. The thing is the potency. If it tastes weird, so you're not getting the therapeutic or other effects that you normally get from a pen. There's a good chance that the illicit market was doing that. The illicit market has stopped. It seems it's cleaned up a lot. We've done studies. We did a study a while back, like maybe a year ago, that did one of the big large manufacturers. He did a buyback program. Just anyone thought they got a fake carton and traded it out with a real one. Illegal. This all went to the BCC and everything. We tested all that material. 90% of the stuff that came back was horribly ridden with THC acetate. So it's all that fake stuff. So Should you buy from the illicit market? The answer is no. Should you buy alcohol from the illicit market? If you want to say you're not even talking about medical stuff, no. Should you buy pills from the illicit market to cure your cancer? The answer is no. I mean, so like those are those things we got to think about as a community. Like if we want to use this as medicine, you don't go down the road and buy the medicine. You go to a pharmacy that's producing it with very strict guidelines. We should treat the hemp product the same or the cannabis product.
Yeah. So I 100% agree with you. And when you put it in those terms, it's like common sense, right? What I think to the credit and benefit of, you know, the cannabis users in states where it's not legal is that the illicit market is where you get your supply, right? I mean, a friend of a friend who has flower for sale, and that's just kind of how it works. So it's just this weird transition that we are within the industry where there's different vehicles to consume cannabis, especially vapes being one. But like you said, there's people that are cutting corners to make a profit when they're not really caring about the health and safety of the consumer. So,
but as you're saying too, buying flower and then a processed product like a vape pen is totally different. Someone had to do chemistry on that flower to make that vape pen. You know, it wasn't magic.
that's the point. That's right. I mean, yeah, you're right. They're actually in a lab coat, and they're doing something behind the scenes where it should be more regulated. There should be more accountability, right, with whoever's producing that, for sure.
Yeah. That's one thing I've always thought. But I mean, I understand everything grew from the illicit market. I mean, I've been here around forever. I mean, one of the reasons why I came into the industry too is I know people that was this medical marijuana was very beneficial for their lives for various things. And
Yeah.
I stand behind it. I personally don't consume marijuana, but I know it's very important. It helps a lot of people. It doesn't make it, you know, I have no negative things to say.
What about CBD? Do you consume CBD?
I don't. I don't consume CBD currently. I've tried it, and I don't really have any ailment that I need it for.
Right.
And if there was, I would definitely give it a shot.
Right. Now that makes sense. Yeah, you don't want to abuse anything that you don't really need. That's the smart way of thinking. You know, I do want to talk about. So it's clear that the cannabis industry has a testing problem, right? So I want to talk more about that from your perspective. I mean, why is that? Obviously, we're still waiting on the FDA guidelines, like we talked about earlier. But is it that we have inexperienced technicians? Labs that aren't really up to standard of where they should be, outdating testing regulations? Like, what is it exactly? Is it all of them?
I think it's a combination of all of them. I mean, there's a lot that goes into it. So to start back and think about kind of the overall picture, why do we have such a problem in this industry? A lot of it came to, I always questioned it. It's like, why is a guy with a psychology degree opening a cannabis testing facility? That's really, realistically, I'm not talking about any one person anyway. Why are you going into an analytical chemistry field or a science field when you know nothing about it? And then money doesn't buy science. You got to have passion, drive, and knowledge. Money doesn't necessarily buy passion, drive, and knowledge. So I think that people saw it as a big money grab. And that's where I think a big problem came from. And then the other thing is in analytical chemistry, normally you have a backbone. And what I mean by that is a backbone of research. Like, hey, how did we do detection of this pesticide on bananas? Well, yeah, there's a method written up. But when we start going into cannabis, well, no one's ever had a method, so they didn't have a starting place. So you had to work a lot to get to good results. And the other thing is, no other industry is really doing what we do. And so, like, a lot of people, I felt like, especially in the beginning of starting this company, was we would kind of be looked down upon. And, hey, you're just a cannabis testing lab. Okay, well, let's think about what a cannabis testing lab is.
View as like the cannabis testing police, like, oh, like it's the wild wild west and these guys are trying to step on our toes, or
that, and then we're like a subpar science. And the thing is, if you look at it as a pure thing, what we're doing, we're an analytical chemistry lab. Right? We're public safety. So what we do here is, normally the lab will say, hey, I developed a method to test this apple, for pesticides. Well, the thing is, once THC can go on absolutely everything, we've actually become an environmental lab, a food safety lab for every product under the sun, cosmetic lab, every other type of lab, all into one, and then they throw it at you and say, do everything. That's not an easy task. People spent years and years just to get cosmetics down. You know what I mean? But now we're doing everything at once just because you can put some THC in it. So actually, analytical chemistry labs in this industry, this is I think one of the hardest ones to be in. And people never really took that into account because maybe they didn't know it or think about what they're actually doing. And it was just, hey, this instrument vendor said, I can sell you this instrument and you can do what everyone else is doing. And that's not true. And that's one thing I blame the instrument manufacturers for doing, is selling a product to someone that's not qualified to use it.
Mm-hmm.
You don't do that. And then that's why this man. So furthermore, I mean, this kind of a long answer, I guess. But then let me start getting into like things. Why can we not have a check and balance system that works? So a couple of requirements, general requirements, ISO 17025, to be a cannabis testing lab. Okay, you can get that. You can also get one by just filling out some paperwork and getting a probationary license for a year. So I fill out a piece of paper, I have a probationary, and now I can start testing cannabis. Okay, so now we have to pass some proficiency tests. Oh, proficiency tests in cannabis, no one was making them. Okay, so let's go ahead and rush that. They went back very, very poorly. Let's say so. And then the other thing is proficiency tests in this industry. Still to this day in the state of California, we have action levels at 100 parts per billion. When the proficiency tests come, the lowest analyte is 1,000 times that concentration. So if you, it's like shooting a rabbit with an elephant gun. You know what I mean? This huge 50 cal gun, and it's like, okay, if you don't see that, you're not even in the same realm. So they're not testing you what we should be testing. So that's one thing I've been advocate for, is to create a proficiency testing program ran by the state, and it's blind. So the other thing about proficiency testing, they come and hand you a sample, or we buy our own samples for a proficiency test run is probably like 15 grand. And then they send you it in this vial and they say, hey, test this neat little solution. So you know exactly when you're doing it. So no one's really policing the testing labs appropriately. I mean, as a testing lab, you should not say that, right? But I say that because I care more about the industry getting things correct than not.
Right. Would you say it's because the level of understanding with what the lab itself is doing and the business and operations that's conducting every day are not, the government's not as savvy to kind of know that, so they're just kind of missing the mark when it comes to these regulations, and
it's an uphill battle. I mean, they're starting with a very few amount of people. I mean, I remember the BC staff had like 4 people that was doing the policing. How are you going to police with 4 people? It's not real. So I'm not, and nothing against anyone that's worked for these agencies. It's like you get stacks of paperwork and they're like, do them all. And you're like, that would take me 2 years. All right, get started. You kind of get what I'm saying? I feel bad for them because it's difficult. And the other thing is, who do you trust? I mean, there's been so many problems with these proficiency tests to make sure we're doing things right. Like, we all do the analysis. No one finds a pesticide. And they're like, well, everyone fails. And they're like, oh, never mind. It actually wasn't in there. Oh, it actually did. So this is a cyclical thing where even the people creating these proficiency tests are ISO certified, ISO 17025 certified. They're still trying to figure out the way. Because these matrices are not as cut as dry as people want to say. Right. I mean, they create degradation. There's problems. There's a million things possibly happening. A million chemistry reactions happening when you start mixing all this stuff together. And that's the thing. The standard manufacturers too have that problem. We've worked through with them.
Yeah. Do you get the sense that the California government, like specifically them, they're open to working with labs like y'all who are on the front lines and learning this stuff? And the reason I ask is because, like you said, we're writing the guidelines as we go because we're at the forefront of this industry, right? And I ask because I know farmers, specifically in New Mexico, who worked with the local government there to write their state plans to submit to the USDA for the hemp bill, right? So they can start cultivating mass amounts of hemp per year. So are they open to that type of collaboration at the lab testing side?
So a lot of it comes back down to when we think about 2016, 2017 area where the regs were getting written. So they weren't necessarily, the BCC, any employee there wasn't necessarily writing those regs. It was a group of people. So they got written. Now the BCC is like police these regulations. And we know changing a law or anything to go through politics and the Senate and all that kind of stuff is very difficult. So they can't just make changes. I understand why it's hard for them. But at the same time, we've been sitting here screaming like, at the top of our lungs, like, hey, your regulations have flaws and issues. And we still don't have revisions yet. And then when we did, they answer all the revisions, but then BCC or any other regulatory has to follow what's written. But that's one thing in the state of California we've seen. I feel like there should be more, or some kind of way to fast track this stuff or fix the problems. I mean, day one, when the first regulations came out, or before that, they wrote this thing called non-detection for Category 1 pesticides in the cannabis industry. It makes no sense. As an analytical chemist, that's the worst thing you can ever write down. What does that mean? If I see a hint of it, I call it fail. It doesn't make sense logically. So then, with that being said, you created the hugest problem in the cannabis industry, cannabis testing industry. If I see it, I see it because I can see very low, because I'm doing the greatest job and putting everything I can into developing these methods. Down the road, that equipment doesn't care. You don't see it. So there's the problem, what we went through with this stuff, and we're still going through today. The best lab at doing what they do as being analytical chemists, at what we are, is the worst lab for a producer to use, because you'll see the pesticides. So that's one thing we've been fighting. I mean, the California Department of Pesticides, over a year ago now, wrote the BCC a letter that they've been asking for since day one, and said, here's the changes that you want, so we don't talk about Category 1 pesticides without limits and action levels. And still nothing's done with it to today. I've written about that. I've talked about that. It's just, but the thing is, I know the BCC, those people can't just make these changes at a snap of their finger.
Right.
But this is one thing. So there's more experience from where we're at. We're also in Michigan, like I said, Jackson, Michigan. We opened up a lab. We officially finally got started three months ago. We made it through the pandemic, and not through, but doing that during that time was very difficult. But a great thing that we have set up out there, there's a group of labs. There's safety compliance facilities out there. That's what we own, one of them. And there's 10 of us on a monthly meeting with all the top people of the regulations that discuss the problems we see in the industry. And it's not like this producer's doing something wrong. No, this is a problem with the regulation. This is where we see holes. As the chemist, this is where you have a problem. And I feel like if that happened in California, or it was more the people actually in the industry, or the scientists are making more, or having more clout on the rule process when creating these things, I think it would go a lot better. There's a reason why we're experts in our field. We're experts as scientists, but let's go ahead and not use the resources I have to develop a scientific regulation. I don't understand the picture where they came up with, this is why we're not going to listen to you guys. I'm here, we're most of us are here to, make sure this stuff's safe for the clients. But at the same time, you have to run a business, and then to start saying we don't know what happens when you inhale the product instead of eating the product. I mean, I understand the point, but there's a lot of things that are missed in it, and we're working towards it. And I wish California, we're working actually on starting a group, and we're inviting the BCC and a few other people to become a monthly calls. And if we talk about different problems happening in the industry, it's not to shut down labs or shut down companies. It's to fix the regulations that were broken to start with.
Right. Yeah, I can't imagine. I'd never understand that mindset of someone not wanting to collaborate, especially when the outside parties add value because that's their area of expertise. And it seems like you could avoid a lot of headaches down the road to just work together initially to get it right the first time, so that the industry is in prime position to thrive and for everybody involved to be successful. Right.
Definitely.
So, I want to talk to you about, so I was going to ask you if there was one state specifically that you would point to where you would emulate their cannabis testing framework. And it sounds like you said Michigan is really doing a good job. Is that who you would cite?
I mean, I think Michigan's doing a great job because what they're doing is, I believe they're being more fluid. Mm-hmm. As in, when the regulations changed, they've changed multiple times out there. And different caveats or something that needed to change is being changed. Or we're looking for vitamin E acetate. We did that quickly. We don't look for vitamin E acetate in California on the official COAs. Why? We know the problem. This is years ago. We developed the method then.
Yeah.
So why are we not doing this? Oh, we got to write the regulations again. That's why. So don't worry about the public safety. Let's write regulations. That's more important.
Yeah, that's outrageous, especially with all the national media coverage around and the CDC's announcement that is a primary culprit of these lung diseases and whatnot. That's very surprising that California wouldn't move to implement that.
So we've been testing for it for years, too, a couple of years, and we will report it if we see it. We will send a side note saying it.
Yeah.
And something we uphold because that's what we're here for. But I'll tell you, it's not regulated to do that. Not all the labs are doing that.
Wow. That's insane to me, man. Yeah.
Yeah, but then Michigan changed that right away. Michigan has that regulation in there where they understood the heavy metal contaminant. They originally didn't write it with heavy metals in carts. You could bulk test oil and then just fill the carts and sell it without another testing step. And then they learn and they make their actions quick. And that's one thing. And I mean, I'm not praising everyone and everything, but that's what I would love to see in California. You know, be able to make changes to a broken thing or a problematic thing or something. So the last call or the last round of BCC comments to write the new regulations that will come out in July, that's one thing they promised is, well, we're going to add a vitamin E acetate to it. A year and a half late, guys. We should really step up on this kind of stuff. And this is our responsibility as testing labs and producers and everything else is to make sure the public's going to be safe. And I know, you know, producer, I'm not adding it, but still, this is those things where we need to let the, you know, be the support for the public.
With California being one of the first states to go adult use, like, does California also, like, are they dragging their feet in terms of adding that updated knowledge of, like, you know, vitamin E acetate and whatnot? Like, or is it just California? Like, is this
There's a lot. I mean, a lot of states aren't doing it. I mean, a lot of states aren't adding vitamin E acetate, or I mean, there's still states that only look at 8 pesticides and things like that. It's one thing is I think that's one thing is we need to live in a fluid, more of a fluid system during the beginning. And to say that as my company, that's the worst thing for me because you can't just change this stuff on a dime. I mean, to validate a method, you're going to take a couple months. I mean, to validate all the methods, you'll spend $250,000 at least. I mean, so now I'm saying to you, is we want to see a more fluid that I'm going to make my life a lot harder, but I think that's worth it. I think other labs should stand up and say this kind of stuff too. And we're going to have a lot harder of a life because you can't just develop things on a drop of a dime, but we can get there and we can be pushing forward. And that's what we need to do with this industry.
Yeah. I love that you're just taking the approach of doing the right thing, you know, because that's what the ultimately the industry needs right now. We're writing our own story, right? With no, again, no consumer oversight and help from the federal government at this point. So anything that y'all can do, you know, with that right approach is key to a lot of players in this industry's success.
So that's one thing we focused on too as Infinite Chemical Analysis Lab. We've always tried to help, even with these hemp and CBD. We feel like the same mistakes have been made and are being made from the hemp companies that the cannabis made. So I mean, it's as simple as making a hemp product. Let's say you're making a tincture. One of the large, I don't know if it's legally said there, whatever. Kirkland olive oil has pesticides that would fail the cannabis regulations for. It'll pop for that less than LOD. So you can't start your tincture with the olive oil from Kirkland brand olive oil, because it's too high of concentration for cannabis. So like seeing these things, looking at ingredients and things like that and stumbling through this industry, I think people need to take a step back. And that's one thing we always want to do is work with people. Where we're fine. I jump on phone calls with a guy in his garage just trying to make a tincture for his wife because she has cancer. I'll get on the phone and talk to him how to do it and how to do it right. And that's what we're here. I feel like as a lab, we're here to bridge the gap between a lot of this stuff, the science maybe in the manufacturers or the science and the home people or anything. And that's why our phones are always open. We have a lot of people answering and we're always there to respond.
Yeah. Well, let's talk about this notion of lab shopping. And how can consumers protect themselves from this snake oil that we've been talking about during this episode?
I think that's a great thing. Lab shopping. It's kind of crazy to me. Lab shopping has evolved and then went back to the beginning. I feel like I'm going to explain that. So in the beginning, lab shopping was which lab will give me a clean result for pesticides and let's say heavy metals or any kind of other contaminant. And there's labs out there that weren't detecting things appropriately because they didn't validate their method properly or whatever have you. Maybe they were just looking the other way. Whatever got them past that. Maybe the dollar was, they had profits over ethics. And that's one thing we're big in. Whatever have you. It started with that. And it contaminates, people would go around and say, hey, I want to QA test this, this distillate. Oh, it fails here for 5 pesticides. Now you go up the road. You QA test it. Oh, it passed for everything. So they do that. So this was a major problem, and it's still seen with the contaminants. And I think primarily the biggest thing now is this category 1 pesticide stuff is a thing where lab shopping is more rampant than the rest of them. Because, I mean, you should be creating data packs to the lab. That's a whole thing you go into, but you should be able to prove your data. And I don't know how sometimes some labs are missing stuff. I'm not saying we're perfect in every such way, but any person that calls and says, hey, I think your analysis is wrong, we go get the sample out of storage, run it again. We don't charge anyone for that. 99.99% of the time we are correct. Sure. Can human error happen? Yes. Mm-hmm. And then we'll fix it and make sure of it. But with that being said, now to go back to evolution. So in the beginning, everyone cared about potency. It was so much. And then it turned to this contaminant thing. Now we've gone back to potency. The potency numbers in this industry are the biggest lab shop thing there is. If you're telling me you can go buy flour from a store for $100 for an ounce, and it has 35% THC in it, 35% THC in it, or you can buy an eighth for $120 with 28% THC in it. I don't think there's actually, you kind of see what I'm saying here? Yeah, one's completely false.
Right. They're kind of over-promising, right?
So it's a bad lab report. So we've seen this, and maybe I shouldn't say this, or maybe I should. I've seen labs fluctuate their potency percentages based upon the time of the year. So when would you want the highest potency percentages? Harvest time, right? Because then we can test all the flower for everyone, and everyone likes my results. Because I'm getting that 30% outdoor that's actually 12%. And we see this. I mean, we've taken samples off the shelves with certified COAs and see 32% on it THC. We test it as a licensed facility, and there's another one attached to it. We see 18 and 12, doubling concentrations. And this is the big, easiest thing, I think, for the Bureau of Cannabis Control or any other regulator to do. Go buy the stuff off the shelf, test it, see if it matches up. If it doesn't, let's figure out why.
So you're saying that some growers naturally are gravitating to certain, and we're talking about the lab shopping, they're gravitating to some labs because the lab itself is known for reporting high potency levels?
Yes. I'll bluntly say it. I'm not going to hide that around. Yes, people are lab shopping deliberately. There are people non-knowingly went to that lab first, and they go test it with someone else. Now they have such a belief that that lab's correct that they
that is so I'm trying to wrap my head around all that, because right now in my experience, I launched a hemp brokerage company, and I represent 2 farmers in Texas, and the Texas farmers that I'm working with, it's their first grow season. Some are starting for the first time, and they're using this first harvest to really dial in, right? Their growing methods, whether it's indoor or greenhouse, and the water and all that, soil. Mm-hmm. And it's a learning as you go, right? And then you get the tests, and sometimes they come back and the levels are lower than what they wanted, but it's a science, and I could see why they would want to do that and cut corners if there's a lab that's kind of boasting higher numbers, because it alleviates all those challenges and pain points that a grower would endure, right?
Yeah. So you've tried really hard to grow the best hemp you could, and you go and you're like, oh, I know I did everything right. Anyone that did something and put their heart into it or passion into it, they did it right, because you didn't learn anything that you did wrong yet. And you go someone, they're like, you did everything great, 100%.
You're
about, oh man, I did everything right.
Yeah.
But now you're pat on the back. But in all reality, maybe that's not true. And then, they use that lab, and last year they're 100% right. Now someone takes it and tests with another lab, let's say my infinite chemical analysis lab, and it came out the concentration is 1/2 of what they had. I mean, we see this double concentration, and they're like, that lab's stupid. They don't know what they're doing. You know how many times I've argued and been on the phone and belittled because I'm a scientist because I don't know what I'm doing? I mean, that the people get keywords like you use standards and or these little hot topic words that came out, and you get yelled at and stuff. That's the biggest struggle to be in this industry, is getting yelled at by people that hated math and chemistry. And I would never take chemistry, but let me tell you how to do your job. It's funny, but at the same time it's not. But we see that, and that's what I think lab shopping has gone to, and it's not just subtle things like someone had 12% CBD flower and now they have
Sure.
I'm say 15. It's more of the going from 12 to 22. And there's various things that could be the problem. The lab should be controlling that. So like a thing would be sampling. So if you have 1,000 pounds of biomass, someone can't send you a gram of it. You need to take big samples. You need to homogenize them. These are things the lab should have developed to make sure you don't have this bias.
Right.
So even with that, we still see the bias.
Right.
I mean, I'm telling you right now, you can tell. Then first of all, THC or CBD potency isn't everything that makes a flower. I can tell you this. Right now, you can go buy product on the shelf that's 15, 16% labeled that's for $80 or $100 a gram or whatever, or eighth, and someone will consume it and love that. And you can go buy the one that's 30% for $100 for an ounce, and people hate it. There's a reason why. It's not all about THC. Or you buy one with 16% and 16% from the same lab, and you'll like one, not like one. So I think the consumer's responsibility is stop looking at that number of THC or CBD, these skyrocketing things. I mean, for a while in this industry, for vape pens, there was a couple labs out there putting for THC over 99.9%. That was their symbol. But then they had 10% of other cannabinoids. And then they had 3% or 5% of terpenes. So all their results was 120%. They did, so that manufacturer did such a good job. He got 120%. We live in the real world, guys. You can't get 120% makeup of this compound or this vape pen. And then that's their sales tactic. Is someone saying, oh, 98% THC and then 12% of everything else, but don't do the math, guys. Logically. And then the consumer's like, oh, I need the 100. I need the higher one. That's not the way it is. You find a good brand, test them out, try them. I mean, be alarmed when you start seeing this kind of stuff. I mean, if you're seeing stuff that goes back to the advantage of if something's too good to be true, guess what it is, right?
Right.
So if you buy your ounce of flour for $70 and it says 35% THC on it, you know what? It probably doesn't have that. I don't care if it's been tested by a state licensed lab. I guarantee it's not it.
Right.
But then this drives the manufacturers or the growers saying, Josh, why do I want to use your lab? I'm gonna have lower results. I can go to another certified lab and get higher results and sell it for more money. I mean, I don't have an answer for that anymore. I don't.
You say it's not how it works, man. I mean, I don't know what to tell you. If you want to go that route, you're going to go the unethical route, really. I mean, I know you can't blatantly say that, but that's, I'm sure.
Well, I do then. I do.
Yeah.
I mean, that's what I tell them. I mean, you can be on the right side. I think the public just needs to do a stance on this and starts asking for, hey, let me see that COA. Let's look at these things. The shop should allow them to see COAs. You go to a shop and buy a product, they should be able to present that COA right then for you. I think the BCC has metric. This should all be public data, and it's not. I mean, this kind of stuff, if I go look at a sample, I should be able to see what lab was tested at, and where the COA is. I should be able to look that stuff up. If a lab gets shut down or suspended, I should, as a public person, I should know why that happened.
Mm-hmm.
So these are those things, these are those core issues that I think people, the public and the consumers need to make the change and need to step up and stand up and say these things or start asking for it. Because if you keep going to a shop and you say, hey, let me see that COA for that. And they're like, oh, I don't have it. And then you say, okay, I'm going to take my business elsewhere. Guess what? That shop's going to get that pretty dang quick. You can start monitoring yourself, making sure you have a safe system. I mean, you'll get a picture pretty quick of which labs might be doing elevated results and which aren't, and if this is the hemp industry or whatnot. I mean, I talked to labs in other states where they're arguing about my results, and I'm like, hey, can you do a rerun on this sample? And they're like, oh, we ate it. And I'm like, did you just tell me as the lab director of that lab, you ate the remaining sample? And they're like, yeah, it was a tough day. And I'm like, I don't even know what to say anymore. But then I'm like, I'm done with the argument of who's right and who's wrong now. You know what I mean? There's so many stories.
At that point, it's like not even worth it. You're not even on the same wavelength in terms of professionalism, and that's been echoed on this podcast. And that's, I think, a good transition that we're seeing right now is before with the adult use in California and THC specifically, you had this kind of Cheech and Chong kind of type of business operation, not to talk down on anybody in the THC side, right? But, there was that sense of a lot of people just moving from the illicit market into now what is is now legal in some states, right? But with the emergence of hemp and the farm bill being passed in 2018, I think that you're starting to see more and more um, professionals in different disciplines kind of entering this industry, and they're bringing a whole new perspective and approach to how we do things. And I think that stories like those are going to be found in books later on, when we were at the forefront of these industries, of this industry. But it's an interesting time now. I mean, everybody's kind of trying to figure it out together, right? And it's
Yeah.
super fascinating, man.
Yeah, I think that's the thing I always stress, even the people starting with the hemp. I mean, just care. Just care is all I gotta say. I'm not saying that for a revenue perspective or anything of my company in any such way. Test the product, make sure it's safe for someone. I mean, what's the best thing to have or worst thing that happens? You spend a few $100. What's the worst thing that happens? You kill some people, kill some children, kill some adults, kill someone's grandmother, or you're feeding her carcinogens and she's developing cancer. I mean, yeah, at some point, look at the human perspective and just be a good person. That's what I would say.
Yeah, no, absolutely. That's a great message to end on, Josh. I really appreciate your insights, man. You guys are doing great things at Infinite Chemical Analysis Labs, and it's definitely a needed service, and we appreciate what you're doing. Before we hang up, is there any websites or social media channels that you want to plug?
Yeah, so we're definitely, we have social media on Instagram, Facebook, all that kind of stuff. But Infinite Chemical Analysis, it's infinitecal.com, and you can transfer between which state you want to work with on that between there. And just look us up. I mean, we're all over Google. Anything else, have questions or anything, feel free to pick up that phone and ask the question. We have account managers, and they can't answer that question right then. A lot of times it makes it back to my desk and you might talk to me.
Awesome, man. Well, hey, you were really fun to talk to. I really enjoyed it today, and I really want to have you on again real soon as the industry continues to evolve and grow.
Definitely, I had a great time. Let me know if whenever you guys need anything.
Cool. Well, thank you again, Josh, and thanks for everybody for listening. We'll talk to you next time. Bye.